Hello, my name is Nicole Hiroi, and this is my PowerPoint for the Culminating Experience for Nursing 613. So just as an introduction, this semester has been a challenging one, but probably one of the most interesting ones I've ever experienced. I'm not exactly sure if this is because it's my first master's levels course, but I feel that it's taught me so much about what nursing really is and what it means, and it's really pushed me to want to do this profession justice. So I know that this presentation is a lot about key issues that I found within the CNL role and within microsystems. So the ones that I have enclosed are the ones that I feel were the most relevant to me from each module. So from the first module, Introduction to the CNL, I really just felt that the key issue was to understand what the role of the CNL is and how we can use knowledge and evidence-based research and practice to work towards better patient care, and really just understanding that fact. And I think that understanding this issue really ties in with the program competencies, because when we understand what a CNL does, it really differentiates between a CNL and the CNS role. And that's something that we really need to understand, especially when we're selling ourselves, along with kind of like what we did with the elevator speech. And also, this issue helps us understand how a CNL is beneficial to a microsystem. Within the second module, the role and responsibility of a CNL, I felt that the key issue was having open communication on an interdisciplinary level, which increases a safer practice for both clinicians and patients. This is really relevant to the end of program competencies because CNLs really are role models on the floor, and they demonstrate their competency in quality improvement and safety. Also, the CNL performs an assessment that really points out what problems are and creates actions in order to have solutions. And for this module, I also did a SMART goal. So I just wanted to really hone in on the communication aspect. So my SMART goal was, within the first 6 months of practicing in the CNL role, I will have established a communication system between all healthcare professional staff. And this will be done by holding weekly meetings where it will be established there that everyone's opinions matter when it comes to providing a safer environment. Of course, this goes a lot deeper than that, but we want to make sure that all healthcare professional staff within a microsystem really understand that everyone has knowledge and opinions about the microsystem that can really help better the microsystem. So once we can start having open communication, it'll really allow for us to put in new actions that can only push the microsystem to be better. And I was toying with this, but this open mode of communication can be assessed by an anonymous survey in which we ask clinicians if they feel that they have open communication within the floor, and if there's any suggestions as to how to increase communication within the floor. So in the third module, quality and safety in the CNL, my key issue was microsystems need to take time to communicate and connect with patients, and it's very important even on things such as daily shift tasks. As nurses, we need to remember that we are patient advocates and create a safe environment for them, and this is really important because this helps us anticipate risks or complications, and communicating effectively can only provide a more safer environment. In the fourth module, looking for the good, I found that my key issue was utilizing pre-existing technologies to increase patient satisfaction and care within our society and within our generation, really. There's so many technological advances that exist, and we just really need to make sure that the research is done to see how they can provide better patient care. And this is really relevant to our end of program competency because it allows us to facilitate change based on evidence that results in quality, safety, and fiscally responsible outcomes. So understanding what technology can do is very beneficial. In Module 5, Institutional Support for Excellence, my key issue was how excellence is not only an ideal to strive for, but also necessary in our society's healthcare environment. This is really relevant to all microsystems because within our society, we find that patients really are very focused on just awesome patient care. That's what's keeping hospitals open right now, and it's something that we really need to focus on. So excellence needs to be strived for. It's completely necessary, and this relates to the end of program competency because we need to use information and communication technologies to document patient care, advance patient education, and enhance accessibility of care, all which end up turning into better patient care overall. So as a summary, I feel that a key issue that I will continue in my next role course is that of communication. When I observe different microsystems, it becomes clear how quality or safety may lack because healthcare professionals do not communicate effectively with each other. So that's something that I think will be that I will continue to really focus on as I continue within this program. Thank you for listening and watching this PowerPoint. Sorry if I was a little difficult to follow. I recently lost my voice, and I hope you enjoy your day. Thank you.